Ayushman Bharat. This is the most useful healthcare policy, lower middle class and poor people. That is also called Pradhan Mantri Jan Arogya Yojana, PMJAY. The say or Atmanirbhar Bharat. How the central government wants to expand its coverage, Ayushman Bharat or PMJAY coverage to more and more people, especially poor and middle class, lower middle class people. Also, the central government wants to cover the people undertaking sanitary workers who are under informal sector, so that they can get the benefit assured under Ayushman Bharat scheme. The center has decided to expand health insurance coverage for formal sanitation workers, to expand its outreach to grassroots level workers through government schemes. Mostly involved sanitation workers like septic tank cleaning, casual sanitation work under the Pradhan Mantri Jan Arogya Yojana or Ayushman Bharat. The government wants to bring all these informal workers for workers engaged in sanitation work like septic tank cleaning and other casual sanitation work to ensure benefit to them under the Ayushman Bharat scheme. Also, the scheme provides health cover of rupees 5 lakhs per family per year for secondary and tertiary care hospitalization to economically weaker sections. The main advantage of this Ayushman Bharat scheme is it provides health insurance coverage up to rupees 5 lakhs per family per year who are economically weaker. The people who are economically weaker are covered under this scheme. Also, the central government has decided that in case of informal sanitation worker is not in the beneficiary list, the government would pay the premium to bring them and their family under the ambit of this Ayushman Bharat. If some people are not willing or unable to pay the premium, the central government has decided to pay the insurance premium required under Ayushman Bharat on behalf of the workers, casual workers, informal workers and their families. The premium will be funded from the Ministry of Social Justice under the scheme, the National Action for Mechanized Sanitization Ecosystem, that is Namaste. The premium to be paid on behalf of the informal workers will be met by Ministry of Social Justice under the scheme called the National Action for Mechanized Sanitation Ecosystem, that is Namaste. At the ground level, it is revealed that how casual workers, especially sanitation workers, had not tapped into the government schemes due to lack of awareness. Many of these informal workers who are engaged in sanitation works are not aware of the government schemes. Those people should be covered early to ensure healthcare benefit to the informal sanitation workers. Out of 42 sanitation workers interacted with to generate awareness, only one worker was beneficiary of PMJ or Ayushman Bharat. The remainder did not have the access at all. It means that it requires a lot of awareness among the informal workers to be covered under Ayushman Bharat healthcare scheme. It is a lack of awareness that is keeping the sanitation workers out of the ambit of government schemes. They are eligible but do not know how to tap into these schemes. Now, the government decided to pay the premium even if they are not in the eligibility list. The government wants to cover more and more people, economically weaker section people and their families to be eligible, to make them eligible under this Ayushman Bharat scheme. One of the stated objective of Namaste is to provide entitlement to informal sanitation workers. The move is to access health insurance coverage in sync with the government outreach to many lower income group beneficiaries, that is economically weaker section people. With Ayushman Bharat, the central government wants to ensure healthcare insurance to economically weaker section people, even if they unable to pay the premiums. The central government decided to pay the insurance premium on behalf of them to to ensure health care not only to the workers and their families also. This is the most prestigious or most useful healthcare insurance scheme for the economically weaker sections or people working under informal sector, maybe sanitation or other sectors.